C-sections. I had a C-section back almost 2 years ago, and it was a very memorable experience, to say the least. I mean, birth, I think in general, is a very memorable experience, but when you have a C-section, it's like its whole own thing. And so, yeah, I feel like when I went through it, I feel like there weren't that many videos on it. Maybe there were, and I just didn't look hard enough. But I know when I was watching it on YouTube, there were a couple of like stories and experiences that I watched, and I felt like they helped me out a lot. Like I just was able to kind of get in a really good headspace and know what's going on, because I think with any sort of major surgery, there's a lot of fear of the unknown if it's something that you haven't gone through before. And so watching stories on other people telling their perspectives and what happened to them, I would stick with the happy stories. But anyway, so this is a positive story. This is just an experience, that I had. And so if you're gonna go through a C-section, I always think that these are useful, and hopefully you will learn something. Hopefully you'll be a little bit better prepared. And yeah, so let's get into it. So I'm just going to briefly explain why I had to have a C-section, because I think that it's different for everyone. It was not an emergency. It was actually a scheduled planned C-section that was like planned about a month in advance. My baby wouldn't flip. So there's a certain point, I'm not sure at how many weeks, but there's a certain point where your baby is basically supposed to flip. And mine didn't. So as it approached closer and closer to my due date, there was a point where my OBGYN was like, okay, we really have to schedule a day because it looks like he's not flipping. And if he flips, then you don't have to do it. But he didn't flip. So I was able to pick a day in April, which is cool. I don't know if everybody gets the option, but for me, it was like a week that I could choose any day. So I chose my day. And yeah, I guess from there on, it's just kind of like a waiting process. I mean, if your water breaks early, you still go in for a C-section, but mine didn't. So the morning of, or actually, I'll say the night before that, I did go to see my OBGYN. I think it was like the day or 2 days before my C-section. I think it was the day before. And they did like a final ultrasound to make sure that he was still breached. And they also gave me this like soap stuff that the night before, when I took my shower, I had to wash my belly with it. I think it's like some kind of antibacterial stuff. They'll still wash it the next day too, before they operate on you, but this is just like a pre-cleanse or something like that. So I had to do that. And then in the morning, we got up super early because we had to be at the hospital. And I think it was like 6 a.m. It was pretty early on in the morning. So we woke up at like 4 or 5. I hardly slept the night before. I tried to sleep because I was like, if I don't sleep, I'm going to feel worse. I'm going to feel more tired and groggy. But I was like nervous, but at the same time, I wasn't. Like, because I was able to be awake during the surgery, I almost felt like I was like less scared, because I was like, okay, like I'll be awake, I'll be present, I'll know what's going on, which I guess for some people is probably scarier. But anyway, we got up super early, got everything ready, went to the hospital. My C-section was scheduled for like 8 a.m. I think, or 9 a.m. 9 a.m. And so we checked in, and they hooked me up to everything. They hook you up to like a belly monitor, heartbeat monitor, blood pressure, like all these different things. They come in, asked a lot of questions. They're just a waiting game. You're kind of just hanging around for a while. And then that's when, like, at some point they'll give you the cue that like, okay, you can go in. And so you go in by yourself. You just go into the operating room, and yeah, I just kind of walked in and I was like, oh my gosh, this is like a scene out of like one of those like House or Grey's Anatomy shows. Like, it's just like this really bright room, and there I am in my gown by myself. I was like, it's okay, it's okay. So they sat me down and they gave me the first shot into your spine. Is kind of like, I think, the numbing stuff, because they're going to put in a bigger needle, which is going to actually numb you. So they did that one, and I was like, okay, this is fine. And then a couple minutes later, like a minute or two later, they put in the other one. So I was able to hold on to the nurse and just be like, okay, I'm okay. It really wasn't that bad. I think for everybody, it's a different experience. A lot of women will say that it kills, it hurts so much. For me, I feel like it didn't. On a scale of 1 to 10 of pain, with 10 being like horrible, it was like a 2 or 3. It was really not bad. I mean, it's a little pinch, but really not bad at all. So anyway, then they lay down, and they were just kind of starting to like put up the curtain, and you know, just everybody was like bustling around, getting their things together. And I thought to myself, okay, so I'm still feeling my belly, because like I could feel them doing stuff, and I was starting to get nervous because I'm like, it looks like they're about to like cut me open. Like, should I say that I'm still feeling it? So I said something. I was like, hey, I still feel that, just so you know. And they were like, wait, do you feel this? And I was like, yeah, kinda. Like I could feel somebody touching my belly, and they were like, yeah. So that was like a really painful, like that was like a knife basically slicing you. We just are testing you. If you were not numb, you would feel that. So they were ready to get started, and I was like, okay. So they numbed me from about here down. I didn't feel anything. And yeah, once the procedure started, for me, I feel like I was looking at the anesthesiologist, and she was so supportive and so nice, and all the doctors around me were like so supportive during this moment. I wasn't having a panic attack or anything, but I think they could tell that I was just like, I was like really nervous. So that's what my dad, my baby's dad, he got to come in, and he was kind of just standing by me here while they operated. And we had also asked for a curtain which has a little screen in it, and that's something that every hospital may do or it may not do. It kind of depends. Some people can even request, I think it's called a gentle C-section, where you have a completely clear curtain, which they did not have, but they were able to provide me with a curtain that was had like a little window inside of it, which was still really awesome. And I was like, yeah, sure, that's totally fine. I just wanted to really see my baby come out. So at this point, when they're operating, it feels like just somebody's rummaging around in your insides. It doesn't hurt. It doesn't feel like anything other than just like a lot of pressure. You know, just like a suitcase or a purse, like somebody's just like digging around in your stomach. So I was like, okay, this isn't bad. Then I got like a really bad headache. That was like my one side effect during the whole entire C-section. Some people have trouble breathing. Some people get nauseous. Thank gosh, none of that happened to me. I had eaten like a bird the night before, which you're not supposed to eat the night before a C-section, and I didn't. I think the last thing I had was like peanut butter toast and some tea, because I was just so scared to eat a big meal, because I was like, I'm gonna vomit if I do, which I think that helped a lot. I didn't have anything in my stomach except a little bit of water, so I didn't feel sick, but I did start to get a super bad headache, and I guess that has something to do with the medications, and of course you're being cut open and you're losing like blood, you know, blood's coming out of you, and there's a lot going on. So it wasn't a shocker. I said that to them. I said, I do have a really bad headache. I'm starting to get a really bad headache all of a sudden, which I hardly ever get headaches, especially like in the morning out of the blue, you know. I knew it was something having to do with the C-section. So they said, that's normal, it's fine. So fast forward a few minutes, this is all happening, and then they start to not take down the curtain, but open that little window. And the baby came out, and I saw Grayson. They kind of lifted my head up, and it was cool because you can't see like your stomach and your insides and stuff. You just look up and you see your baby, and it's really awesome. If you are okay with like that kind of thing, with seeing your baby covered in blood and stuff like that, like I would highly recommend to do that, because I know when you have a C-section, you lose out on that moment of like instantly like pulling your baby, just basically seeing them right the second they come out. And that allowed me to still have the same experience in a way, you know, the same timing, same experience as like giving birth regularly. I didn't feel like I just had a curtain in front of me and then my baby left for 10 minutes and finally, oh, hey, 10 minutes later you see them, which it's okay if that happens too. Obviously it's not something to feel bad or stressed about, but it's just nice if you can do this. So I saw him, and then they wheeled him away to go weigh him and clean him up and all that kind of stuff. And just a couple minutes later, they brought him back, and the nurses were so sweet because they were taking like photos of the three of us. I was able to hold him and kiss him, and just like, it was awesome. It was awesome. We got photos, we got footage, we got videos. It was really great. So then at that point they had to take him away, and they basically started to stitch me up. I think they started to stitch me up when I was already holding him, obviously, but this is like the point where I was by myself at this point again, and they were basically just stitching me up. And it was just like a waiting process, but I felt okay, especially knowing, I was like, wow, the tough part is done. They took him out. It seems like everything's fine as they're putting me together, which means that like I'm okay. They stitched me up, they took everything down, and then they, you know, all had to pick me up and put me on the wheelie bed. and they rolled me into another room where I was able to then hold Grayson, and I was able to breastfeed him, and you know, just have that kind of like few minutes after the C-section with him. And then that's when I started to get super, super cold. I got like the worst shivers ever, which again, super common. Probably something to do with your blood pressure or the medications that they give you during your C-section that start to like go away, or, you know, whatever it is that control your body temperature. I was like freezing, so they put a bunch of blankets on me. It went away after a little bit, and then I started to feel these little compression things on my legs that they put on you, because obviously when you have a C-section, it's like hours and hours that you're just laying there. So the compression machines basically pump the blood through your legs so you don't get totally numb when you stand up, and then you just, you know, you would like collapse back down. So that made sense to me, because at first I was like, what are these? And then it made sense. Yeah, that was pretty much the procedure. Then you kind of just take it easy. I was just laying there, and once the pain starts to come as the medication subsides, the pain does feel like it comes pretty quickly. Because as it wore away, I was starting to have a harder and harder time sitting up. Because at first, the first few hours, I was like in baby bliss. You know, I wasn't tired at this point because I just went through a pretty quick C-section with, thank God, no complications. I was able to just kind of hang out and chill with everyone, just, you know. And then, like I said, the pain starts to come because the medications wear off. And oh boy, that's when it starts getting difficult to really move at all. And I would highly recommend, if you have a C-section, to bring a Boppy or the My Breast Friend pillow, which I actually had both. I bought the My Breast Friend, which is shaped a little differently, later on in my like postpartum, but I had the Boppy, and so I was able to feed him that way, because it honestly hurts so much to lift at all. That night they also make you walk. Usually they make you walk the day of your C-section. So since mine was early in the morning, by I think like 5-6 o'clock, the nurse came in and she was like, all right, we're gonna walk. And I was like, I don't think I can walk. Like, there's no way this is happening right now. I'm in so much pain. She's like, you can do it, I promise. And I was like, oh my God. So I did. I tried to stand up, and I walked, and I went to the bathroom and everything, and it was like the most excruciating pain of my life, because for obvious reasons, I just had major surgery, and you know, it's painful, but it's worth it, because if you actually let yourself lay there in bed for 3 days, oh my gosh, it'll be so much worse if you stand up. So I noticed the more I moved around, and I tried to do this my whole entire stay, the more I moved around, the better I felt. Like, getting up, the worst part of it was just from laying down for a while. Getting up, that was the most horrible part. Once you got past that and actually got onto your feet, taking the steps as you took more and more of them got easier and easier. So it really is important to move. As painful as it is, you have to push yourself through that. And so I was able to shower the next day, which made me feel so much better. It was just like a relief. And yeah, the one other thing I have to say is that they first had me on Percocet as my like strong painkiller medication. And I really quickly realized that that wasn't working for me, because I took it the first day after my C-section. They started giving me the drugs before the numbing stuff even wore off. Like, I was already starting to prepare myself for the pain, and I instantly felt horrible. I felt loopy. I guess it's not loopy. I just felt kind of like in a cloud. Like, I was present and I could talk to people, but I had cotton mouth, and I don't know how to even explain. I remember looking at the TV screen and almost feeling like I had to zone out, because my brain wasn't there. And at first I didn't know why that was happening, because it wasn't really clear what they were giving me. Not like they were hiding it, but I feel like they were just like, okay, time to take your pain meds. And so I just took them, not knowing anything. And then I started to realize that it was Percocet, it was really strong, and it was really affecting me a lot, and I didn't feel good. I also had a hard time eating, because I was in a lot of pain. When I'm in pain, I can barely eat. And not eating mixed with the combination of taking a drug like Percocet is like the worst thing ever. So I really quickly realized, like I said, the next day when I couldn't even go to see my baby get his first bath because I was so nauseous from taking all the medication and from not eating enough, I said, you know what, I'm not going to take any of these heavy things. Just give me like some Tylenol, extra strength Tylenol. And that actually was what worked the best for me. The pain was stronger, but I actually had more of an appetite. I was able to eat an actual amount of food. The cotton mouth after a few hours went away, and I felt more present, and I didn't feel nauseous. That was the biggest thing, is I could move around, I could see my son, and I was in the moment, and I just felt a lot better. So I actually, after that day, I did not take any Percocet throughout my whole entire postpartum recovery. I just ended up kind of trading off between extra strength Tylenol and Advil, which was actually the best thing for me. And I know some people can't handle that. I know some people don't react the same way to stronger medications. Like, those things might be a savior for you. And so no judgment at all, but I think if you can try to kind of push through the pain, it'll make you feel a little bit better to take stuff that isn't as strong. The other thing I want to talk about is how important it is to make sure that you pack accordingly for your C-section. Because you're obviously going in for a C-section and not a regular vaginal birth, you should pack just slightly differently. I would say a lot of the stuff is the same. You're gonna bring comfortable clothing, but whereas if you have a regular birth, you might bring something that's like just regular pants. With a C-section, you obviously have that scar, so you might want something that goes right above it. You could go under it, but I wouldn't recommend. I would actually try to go above it because it just makes you feel more secure. I went with leggings that weren't too tight, but also weren't super loose. Like, they just felt like they hugged everything tight enough, and they went like almost like super high, like up to here. But honestly, it was like the best thing because I didn't feel like I had any irritation. And when you have that scar, you're like so careful. The first couple days when I was like having to use the bathroom, I would like slowly peel away my leggings or whatever I was wearing, because I was just like, oh my God, like it hurts so much. It does hurt. Like, and I think you just get paranoid about anything, touching it or rubbing up on it. So definitely pack accordingly. I wore nightgowns in the hospital. I actually had a couple of them. And then, like I said, I just brought really loose pants that would go above the scar, and that was the best thing for me. Definitely pack grippy socks, comfy, cozy ones, because your feet will get cold from laying a lot, and the hospital floor is obviously cold. So you can bring those and some slippers, shower shoes, just all the regular things that you would bring normally postpartum, but just make sure you kind of tweak it a little bit to make sure you're comfortable post C-section. And then a boppy, like I said, or some kind of feeding pillow. You could use a regular hospital pillow too if you forget, or if you don't want to carry it. I just think the boppy kind of conforms around your body a little bit better. And then I think that's pretty much it. Postpartum, the hospital does provide pretty much everything you need, including like the mesh underwear that you still do have to wear because you do bleed regardless of what type of delivery you do. So I think they cover you for most of the stuff. They gave me a ton to take home because they are so comfortable that I wore them for like 4 weeks after, because I was just like, I love these so much. And they were honestly more comfortable than any of the underwear that I paid like a bunch of money for. So yeah. And yeah, so then when we got home, it was pretty much, I actually ended up going home a little bit early. I just want to mention that you shouldn't rush out of the hospital, but I didn't feel like I did. I actually felt amazing by the 3rd or 4th day. I was in a lot of pain, so I'm not saying I was like walking on a cloud. I was in pain still from my scar, but I was so sick of being at the hospital. I just wanted my own food, my own bed, and my own stuff. So I ended up going home a day earlier. I think I was scheduled to leave on I want to say like a Friday, or I don't exactly remember the day that it was, honestly, but I was scheduled to leave like the day after, and I ended up leaving a day early because I was just like, I was cleared, I was doing fine, I didn't have any issues, thankfully, and my baby didn't have any issues, thankfully, so everything just was good. And they were like, are you sure? I mean, you can stay an extra day. And I was like, nah, I'm good. And I ended up walking through the whole hospital. I didn't use a wheelchair. I walked, and again, this is very, very subjective to each person, because that was my experience. I completely realized that some people have a way harder experience, and if I have kids in the future, who knows, it might not be that easy. I was 23 when I had my son, which is obviously a lot on the younger side, so maybe if I have another kid when I'm closer to 30, it might not be as easy. I'm not sure, and everybody's different. I'm also very petite, and I was also pretty fit before I had my son. Before I even got pregnant, I was skinny and I was pretty fit. And then going into the pregnancy, I did not put on a lot of weight and I was moving constantly. I was moving a lot. So I think my body was just like really, really ready to move, you know? I feel like I kind of set myself up to like be really active postpartum. And yeah, when we got home, I ended up sleeping on, we had like a reclining couch and it had like a button. So you didn't even need to put any pressure on, you know how some of them, when they go up, you have to like put pressure for them to go down. You have to like kick them in. It just had a button on the recliner and it would just go out and it would go in. And I ended up sleeping on that for the first like week or two, because when I would lay down on the bed, I would get like, it would be hard to breathe, which is actually a side effect of the surgery. This happens to quite a few people. And it was just like so hard for me to breathe. And so, and also really hard for me to get up to feed my son in the middle of the night. It was overall, it just wasn't working for me. Even doing pillows, like it just wasn't comfortable. So I found that the recliner was the easiest way for me to be able to like get myself up and lay myself down and to find the perfect angle for me to sleep. So if you do have that, just be aware you might need to shift around your sleeping situation a little bit for the first few weeks. But yeah, so the first few weeks, like I said, they were hard. You know, it's hard to move around. It's not like it was, you know, even pre C-section. Like you think like, oh, it's hard in my 9th month, but when you go through labor, those first couple of weeks are really tough on your body. Try to get a lot of rest. It's so hard with a newborn. I totally get it. And if you don't have help, that is much, much, much harder. And, you know, even if you do have help, it's hard with a newborn because they mainly want you. And if you're breastfeeding, I was breastfeeding, nobody can really do anything, you know, like, yeah, you can pump, but at the end of the day, like you're the one that's going to get up at night, you know? So it is hard to get like the full rest that you used to have, but try to take naps, try to have help, try to ask for it, and make sure that you are taking care of yourself. Drink water, eat good meals. I actually lost a lot of weight postpartum because I just found it super hard to eat. I think I had anxiety. I don't think I had any PPD or anything, but I'm pretty sure I had some pretty bad postpartum anxiety. Because I was always worried about my baby. It was also my first baby, so it's understandable. And I was just finding it so hard to eat because I was still having the pain from the C-section, and you know, life just like totally flips on you. Everything is different. So sometimes it takes time to adjust to that change, but make sure you are taking care of yourself. Take a moment, take a breath, watch a movie, like just do something for yourself that takes your mind off of the whole thing, and you can like focus in on yourself, because even if you can just do that once in a while, it is really important, and it does help you heal physically and emotionally, mentally, everything. So yeah, I think that's pretty much it. That was my story, my C-section story. I hope it kind of gave you some insight as to what to expect if you are going to go through a C-section. Just know it'll be okay. Don't stress too much about it. Just prep yourself, just be ready for it, and don't think about it too much. You know, don't overthink it. Don't sit there all day leading up to it thinking, oh my God, I'm getting a, like, just think I'm going to have my baby at the end of this. The nurses, the doctors, they know what they're doing. They've done this a million times. I'm pretty sure the doctor I had, he was on the older side, he probably has delivered like 10,000 babies. So, you know, they've seen it before. Whatever situation you have, they've likely seen it before, and they'll be able to do everything that they can, and they will make everything okay for you. So thank you so much, you guys, for watching. If you like this video, please